Yeah, I do.
Now I want to see, can anybody reach down? So you can do that seated. You can do that seated as well. Try to reach down for your toes. No, that's it.
I can touch my toes.
I can never touch my toes.
Really?
There you go, touch them, touch them, touch them, touch
They're not
them.
good. They're not good at training flexibility anyway. They're only good at training
I can
inflexibility.
touch my toes.
And then how about extending backwards?
Easy.
That's better.
Oh.
That's pretty good.
Oh my God.
For a surgery too? Nice job. So what happens a lot of times with those surgeries is they fuse your vertebrae. So a lot of times to get down that low, you need to have lumbar spine flexion.
The spine, they took the bone that was in front of the sac of nerves.
Yeah.
That round plate.
Yeah.
They took that out.
Yeah,
They put nothing there.
Oh, it's usually a laminectomy and fusion. There's usually a fusion associated with that.
Okay, maybe they did. It's been so long
Yeah.
since I had it, I don't remember.
Yeah,
what
usually
they
it's
called it.
combined with the fusion, because they're taking something out, they gotta do something to
Let's see if
solidify
he's
that
got
area.
it, that
So when you fuse it, those vertebrae are never gonna move again.
Yeah,
So when you gotta reach down like this is a function of your lumbar spine. You can have a seat, I'm sorry, I'm just talking to you guys at all.
I had a fusion done, spinal fusion done in my neck.
Yeah.
C4 and C5.
Yeah.
Right?
Yeah.
And he said I turned like crazy, he couldn't believe it, and that took my pain away.
Good,
immediately.
that's great, yeah.
But that was fused and I could still move it.
You can still move it,
Yeah.
but those two levels aren't moving. You're moving at other levels.
Okay.
So the other levels are taking a little more damage as you age, but it seemed like a success anyway.
That
You know what I mean?
was more like this here.
But yeah, with the fusion, if those vertebrae aren't going to move again, you got to get it from somewhere else. So now the vertebrae above and below have to move more, and your hips need to move a lot more to accommodate for that. You just might have really flexible hips.
I just got a hip, I had a hip replacement when I was 55.
Okay, they did a good job with you then. That flexibility is pretty good, and that forward bend is tough for a lot of people. So cool. I got to see you guys move around a little bit. There's some deficits there, but that's kind of common. All right, so we're getting close here. This is a little bit longer of a slide. I got to kind of go through some stuff. But the 3 common causes of low back pain and sciatica. So I'm going to write these up here so everybody can see. Let's go in black. Yeah. So number 1 is herniated disc.
That's funny.
Number 2, stenosis. Probably, have you guys heard these words?
Yes. Yes. You love
These are all lumped into one. They're all pretty much similar problem. DDD, which is degenerative disc disease, or anybody heard of that?
I have a joint disease.
Same thing. Yeah. So your discs are a joint.
Yeah.
Every vertebrae you have is an individual joint all the way up and down your spine.
Yeah.
So it's just another way of saying the same thing.
Yeah.
And arthritis. Oh, well, so those are some of the most common ones when it comes to just the normal aging process. And then the other one, which really kind of, this goes hand in hand with it, is, and a lot of people may not, tease this one out, but it's just a hypomobility problem of the hips, back, pelvis, or SI joint. If anybody ever heard of that sacroiliac joint. That can cause a lot of pains down your leg. It's a lot of common symptoms of...
That's the one in your lower back, real low, right?
Yeah, I'll show you in a
Very
second.
hard to treat that one.
Hypermobility.
Yeah.
That's right, hips, SI, pelvis, which is similar to the SI. So the pelvis is basically a combination of a couple joints, but it's your pelvic girdle, it's your iliac crest. It's basically, I can draw a picture in a minute, but it all attaches to your sacrum, which is the continuation of your spine. Your sacrum is just that tail. It looks like we don't have like a picture of a spine here, but it looks like a little tail at the bottom, and your hips actually connect to that. That's your SI joint, where your hips connect to that tail of your vertebrae. So that's the 3rd common cause. So let's start with the first one, herniated discs. So I know a lot of this might be on your MRI, but really the reason that you would be in physical therapy or you have a diagnosis, this would be your diagnosis, it's more affecting people that are 35 years old or younger. So the older the disc, it's not the problem. So if you're older than this age, it's really not the disc that's causing the problem. The reason the disc is is an issue with the 35-year-olds is they don't have all that degeneration going on. So if they have these symptoms, it's likely the fact that the disc is causing the problem. Perfect example of this, we had a patient, he was about 20, 26 maybe, he was a baseball player. He hurt his back lifting stuff, he's a carpenter also, lifting like heavy, wood tables and things like that. And he was having leg trouble. He was having that pain down his leg, having pain in his back off and on. And he was at his wit's end, and he came to us and he was ready to get surgery. He had it scheduled 3 weeks from when he saw us. And we were like, can you just hold your horses? You're young, you know what I mean? You're gonna limit your spine for the rest of your life if you get that laminectomy infusion. Let's just try physical therapy first. And it wasn't even suggested to him to do it. And see what happens. And we did it. He spent maybe 2 months in therapy, maybe a little less. And to this day, he's playing baseball. He's still a carpenter. Zero pain, zero problems on his leg, and he avoided the surgery. Pretty big story for that one. But if you see the reason you want to get a surgery is disc herniation, really that shouldn't even really be the cause of it from an older standpoint. If you're older than 35 years. All right. So number 2 is the arthritis one. So many people have heard of this: stenosis, DDD, arthritis. Anybody over 50, that 50 candles on your birthday cake, this is for you. This is the pain with standing and walking. This is the relief with sitting down, because sitting down puts me in a moment of lumbar spine flexion. This is also people, they might walk bent over a little bit, holding a walker, or they get relief when they push a shopping cart if they don't use a walker. So does anybody fall into that category? They have pain with walking, standing.
I like pushing a shopping cart better.
So pushing a shopping cart relieves some of your symptoms?
Yeah, sure.
Okay. So that's the telltale that it's number 2 right here. It's the stenosis, DDD, which you might know already from your diagnosis. Hopefully they got that down. So the most common level of this arthritis or stenosis or DDD is L4, L5. So the space narrows and shortens in between the vertebrae in the foramen where it opens up, and when you lean forward, that's why it feels better. So we have all this here, but I want to draw a little picture. Hopefully, don't make fun of my horrible drawing skills here. But if I can illustrate how the spine works and how arthritis and DDD, so you guys, that's a lot of technical jargon I just spit out, and I think it's nicer, at least in my mind, to see it rather than just kind of talk about it. So if we think of that L4, L5, I'm going to draw a couple of vertebrae here. So we're going to do a little vertebrae, a little cutout. That's your vertebrae. This is the bone that creates the joint up and down your spine. So this is where the disc sits. Right here. This is the back of your spine right here. So if we look at, this is the back, and this is your front. All right. I'll draw a couple more vertebrae to give you guys perspective here. I'll go one more. Very basic. So your disc is kind of like a cushion of the joint, and that's going to sit right between each vertebrae. Just like that. Okay, so this is L4, L5. This is the most common area that people are going to break. I'm sorry, you can't see that. This is the most common area people are going to break down at. We describe this joint right here as L4, L5. So our spinal cord runs straight down here. Not too thick right here. So our spinal cord runs straight down through the spine. It's being protected by these bony vertebrae right here and these discs to cushion in between. Now with spinal stenosis, DDD, arthritis, we have to have nerves that come out, and they come out right here in this little opening. So what happens right at L4, L5, probably not going to use red for that. It's too. This space starts to narrow because all the arthritis starts to build up right here on either side. You see how that's kind of getting real tight in there? And then what happens is when you extend backwards, so if I do this, this is making it even smaller, the space. It compresses it, exactly. So it's causing entrapment of the nerves that run out. So nerves are running out of each level here. It can compress those nerves. It can compress the spinal cord. So there can be issues with, pain down your leg, things like that coming from this area as well. The idea of that herniated disc that we talked about, I can illustrate that a little bit up here, is the disc starts to compress, and this kind of connective tissue that holds this together, things in the middle here start to kind of bulge out, and it starts to compress on nerves. But this one is the more common one that we'll see. So as that area gets, arthritic changes happen here, it gets narrower and narrower for the nerves to be able to run out. And that's why you can see if I bend forward, what's going to happen here? The spine opens up more and decompresses. And that's why the leaning on the shopping cart feels better. That's why the sitting feels better. That's why you start to develop a fear avoidance of being in this extended position. So you start to kind of slowly just be like this, which is not a good thing.
No.
Because now then gravity is like a camel on your back. It gets heavier and heavier the more degrees you tilt forward. And last but not least is the hypomobility problem of the hips, back, and or pelvis. We see this a lot. And honestly, if you've gotten a surgery here, that's what we can change. So the immobility that